The next speaker I'd like to invite is Kelly Antes. And I'm sorry, did I say that name wrong? So Kelly, she is a social worker at the Princess Margaret Hospital. Now, Kelly, I think, is coming in right at the perfect time to talk about specifically how do you talk to caregivers and how do you talk to your children about such a diagnosis as cancer. And she's worked with many stomach cancer patients as a social worker, and we'd like to give her a warm welcome. Thank you.
Thank you so much for having me here today. I'm so honored to be here. As Katie mentioned, I'm here to talk about psychosocial and supportive care and the psychosocial impact on someone diagnosed with cancer and their families. Social workers at Princess Margaret are part of the psychosocial oncology service within the Department of Supportive Care. We help people and their families with emotional and practical aspects of coping with a diagnosis and treatment of cancer. I'll go over some of the practical concerns many people do cope with and some resources. Many people talk about the financial impact of cancer, prescription drug coverage, transportation and parking, accommodations for people who live a distance from the hospital, advanced care planning, child care, and other possible costs. I've listed several resources more for your reference. I won't go all of this in detail, but we are available to help people evaluate which financial programs they may be eligible for, to review the forms, to go over how to apply for such programs. There's also financial support for caregivers that social workers at your hospital or at Wellspring can help you understand and apply for as well. Other costs that people do talk about and we help with are health-related costs like dentistry, fertility preservation, outpatient physio, medical alert bracelets, hospital costs for people who are admitted to hospital like television and telephone, home support services, home safety and mobility aids, and travel-related costs. Many people experience difficulty getting to the hospital, so many social workers work with people on transportation plans. We often refer to the Canadian Cancer Society and the Canadian Red Cross, which is across Canada. But your social worker can help you identify other supports within your communities that may be helpful as well. For people who live in Northern Ontario, there is a Northern Ontario travel grant, and for people on Ontario Works or ODSP, they may be eligible for some financial support for transportation as well. Social workers also work with people on advanced care planning, preparing for the future. That can be a very difficult topic to think about and to talk about, but we find it's really important and it can be very useful to have support around conversations with your loved ones and really thinking about who you would want to be your substitute decision maker, if you ever needed that, your power of attorney and wills. There's a website at the bottom of the slide that's a good reference and good resource if you're interested. We've talked a bit about children today, and I've listed some good resources. Here at Princess Margaret, we have a child care for people who need to bring their children to their treatment or medical appointments. There's a great program called the Nanny Angel Network, which help mothers with cancer by assigning a nanny who can help a few hours a week. And then we also explore someone's support network and try to help create plans with people for support for the kids. Many people experience a lot of fear, guilt, pessimism, sadness, anger related to living with a cancer diagnosis, but also experience hope, joy, optimism, and those feelings can be complex and hard to experience. Fear is a normal feeling when you feel your life is threatened, that you're sick or in pain. Worry can affect people, worrying about finances, like we talked about before, your response to treatment. recurrence, anger at the feeling of being unwell, why me, which is a very normal question to ask, guilt, feeling concerned about being a burden, numbness and sadness. I like to explain the difference between sadness and depression because I do think that's very important. Sadness feels being sad and tearful and can result from many losses, such as the loss of your health, loss of control, changes in your lifestyle. Depression is very different from sadness. It's a severe, enduring state of extreme sadness, negative thinking, isolation and withdrawal from others, and can affect your eating and sleeping habits. We feel, the psychosocial team and your medical team feels it's very important, and Dr. Swallow talked about the psychosocial impact of surgery and treatment. We feel it's very important to address these feelings and if you are experiencing depression, and there is psychiatry and social workers on staff to help you with this. Other concerns can include guilt, feeling like a burden, a feeling of a need to protect yourself, the patient, or the caregiver, and that can impact communication between families. Loss of control, feeling helpless, a loss of independence and isolation. There's a lot of support in the community and within the hospitals to help address some of these feelings and help you feel good, feel better. There's cancer support agencies, like the Canadian Cancer Society, Wellspring, Gilda's Club, My Gut Feeling. There's web-based and telephone support, and family counseling and mental health agencies that exist that your medical team can help you identify as well, if you'd like. At Princess Margaret, we have a psychosocial oncology department, which includes social workers, psychiatry, and psychology. There's lots of patient and family education. There's a mindfulness-based stress reduction program, and you'll hear from Mary Elliott a little later today, who's the psychiatrist who leads that program at Princess Margaret. There's relaxation therapy sessions offered through our occupational therapists, and we have a center that has a wide variety of classes and a kitchen. I'd also like to talk to you a little bit about palliative care today. Many people view palliative care as a transition point in their care or associate it directly with end of life, and that's not all that palliative care is. In fact, it encompasses much more than that. So I'd like to define it today. Palliative care is provided by healthcare professionals for people living with serious illness in their families, not just at the end of their life or at a transition point. They support the right to make decisions about healthcare based on your wishes and your choices, and they can be a part of the care you already receive. So most of the time, palliative care doctors are working alongside the medical oncology team, radiation oncology, and surgical oncology. The goals are to relieve suffering due to pain and other symptoms, to provide support throughout the illness, and to improve someone's quality of life. Palliative care helps people at any age, at any point in their illness, not just at the end of their life, and whether or not the illness can be cured. You don't have to have cancer to be involved at the palliative care team, and it can be provided at home or in the hospital. Many people ask, when should I receive palliative care? And that's usually a decision made with your doctor and involves managing symptoms and preventing new ones from occurring, helping to plan your future care, and support for yourself and your caregivers. As I mentioned, you can receive it in the hospital or in your home. It's available at palliative care units for end-of-life care, and residential hospices for end-of-life care as well, and long-term care. I like to talk to everyone about the balance of information overload and self-care because it is important. Because it can be a diagnosis of cancer and treatment, and coming to your appointments can easily take over your day, your weeks, your months. And it's important to remember what you enjoy, the people you enjoy being around, caring for yourself. So there is a balance between the two. I like this quote: "Know that deep inside you are resilient, brave, and so much stronger and more powerful than your fears." Does anyone have any questions? Oh, thank you.
Hello. My name is Rosa Mantla from Yellowknife, close to Yellowknife, Northwest Territories. I'm hearing a lot of information and really good to ask questions about, especially all the services that some provinces can provide to patients and the families. In many of the northern or indigenous communities, smaller communities, sometimes these type of services is lacking.
Yes.
And when Dr. Christopher talked about educating people in the communities about, this is the topic of stomach cancer, but there's various types of cancers that are being an awareness in a lot of the communities. Sometimes it's hard to understand what types and even to name them in indigenous languages. So to describe another presenter's topic of dietitian, when you don't have the types of food or fruits or vegetations, all that has to be explained to the patient in their languages, how they can eat healthy, how they can be able to function, to strengthen their health, especially when after having surgery. I find that there's many opportunities of how people can work together, especially the awareness of this type of conferences, so that people will have better understanding, especially for the future of our younger children. In our community, I always talk to, because I've been with education for years, and especially with our cultural, how we tie in our cultural activities relating to health, and we use a lot of country food, but with climate changes and banning some of the animals that we usually eat, which were good health to our people, we still live that livelihood, but it's not as healthy as it used to be. So not having nutritionists in our communities or dietitians, or even lacking support workers. These are the functions of not being able to understand how our people can be really well given the type of services they need, especially when it comes to counseling. Like when Leanne was sick, it was so talking about emotions. We were so emotionally hurt, depressed, stressed, and there's so much that goes on and makes you angry. But we do have our elders that talk to us, and we have some spiritual people. The one thing that our elders always tell us is we have to be strong and be able to be hopeful. So I always talk to some of our people saying we need to do more for health, the health caregivers in our communities, they need to do more awareness programs in the community so that people have better understanding. And just looking at the presentation, you can understand what's happening and what it does, how the doctors can help people. And if you understand what the language in English, which I can catch or to understand, but in indigenous languages, there's so much that you have to explain in detail. Like for the word cancer, there's about 3 words that are attached to just that one word. So all those information that it's just kind of filling up my mind of how do we put it all together. But I'm so happy that I'm here just to listen and to gather a lot of information. But I'd like to say Masi Cho for having me here with my daughter, and also for my Kingston government people to sponsor me to come here, because they've been having a group of people in the north. The last 2 summers, I joined their Hutitseda conference. It's under Health Canada, but it's under all organizations, the Aboriginal organizations in Northwest Territories. There were presentations that were presented where some elders work with a researcher in the Delta, in close to Inuvik, and they did research on stomach cancer. That's how I got interested, just listening to all those presentations. So even for myself, I have to ask if they can sponsor me, just so that I can be part of this. Masi.
Hi, I've just got a quick question. I saw a mindfulness program, and I thought, I know a problem I'm having is mindful eating, because I have to relearn how to eat without a stomach. Have you heard of any programs starting up with mindfulness of eating or overcoming lifelong habits?
I have, and Mary Elliott is coming up, and she'll definitely provide more information, but I know in her course she does talk about mindful eating, and she'll be a great resource. Thank you everyone so much.
Thank you so much. Don't go too far, we're going to have our panel.